Okay, I believe we will go ahead and get started this morning. This is Lisa Hurley, York County Development Corporation. Thank you for joining us for our October 29th York County Community Briefing. We appreciate all of you, both on the Zoom and on the Facebook stream, joining us. Facebook is working today, so hopefully we have that down going forward. As a reminder, please keep your microphones on mute if you're not speaking. If you have questions or you want to talk, you can talk during your sections, or you can just type in your questions either on Facebook or on the chat here, depending on how you've joined us. And so now I would like to introduce Laura McDougall, our Four Corners Executive Director. Go ahead, Laura.
Good morning, everyone. Welcome to the call this morning. I'm going to go ahead and start off with the public health report and look and tell you about our numbers as they are currently, and then also talk a little bit about what some of the issues we're facing and what we're looking at going forward. We've been accelerating pretty steeply in our district for the last probably 3 or 4 weeks, 5 weeks. And what we're kind of seeing happening now is that our acceleration has slowed down, and now we're just heading into maybe a little bit of time here where we still have high numbers, but I don't know that they're accelerating as quickly as they were, which you know, we would like to see now it turn around and go back down. But we had, in looking at the Nebraska statistics, we're seeing this really happen, increases in cases happening all around the state. And especially, you know, the numbers still are really coming in from Douglas and Lancaster counties and some of the counties to our east. But we are definitely on the upswing in the rural areas here too. Looking at our totals for I hope everyone's been able to see, we've been putting out our numbers, trying to give you as much data as we can to keep things current. We have been having some problems getting some of our lab results coming into our systems, which leads to disparities sometimes between what you see on the state dashboard versus what Four Corners is putting out there. We have quite a few cases that we've been notified of that are not making it onto the state dashboard because it's somehow the labs aren't being, they're not coming into the system and turning around to notify the state of those positives. So we're going to be working on that this week. But as for the Four Corners numbers, just looking at the last 2 weeks, we have, looking at October 22nd through the 28th, we had 260 cases. And looking at the previous week, we had 260 cases. So in the last 2 weeks now, we've had the same number of cases. That doesn't necessarily hold true for every county, though. Some of the counties have gone up and some have gone down a little bit. York County went from 85 cases 2 weeks ago to last week having 79 cases. And so yesterday, you know, that might change again because yesterday we had 67 cases in one day. So, and York County had 20 cases in one day yesterday. We're seeing things just, they kind of ebb and flow. So, but we saw an increase, last week Seward County had 109 cases, Polk County had 29, and Butler County had 43. What we've been seeing with our data is that weeks ago, probably in August and even a little into September and during the summer, we saw that we were seeing the largest number of cases in the people who are young adults, like in their 20s. And now we're starting to really see that people in their 50s and 60s are mostly are the highest number of cases that we're having. And then it's trickling up into even the older age groups, as well as we're seeing some kids in school now turning positive, but really what we're seeing is that it's a lot of the adults that are moving around in the communities that seem to be turning positive, and then which results often in quarantines for kids and the spread into the other age groups as well. So just to kind of give you a heads up on that. And I'm hoping too that our medical groups here can talk about testing. They have a really good handle on that. We are actually already getting Test Nebraska results in this morning from the Test Nebraska event yesterday in York. So we've already got quite a few positives out of that this morning, and things are really hopping here this morning. So we really like to see those test results turning around quickly, and they have been. So, and we also have rapid testing available in our areas, and we have some other lab testing that is coming back pretty quickly. So I feel like we're in good shape with the testing right now. We're seeing a lot of that test turnaround coming back pretty quickly. We have been seeing some clusters in businesses, clusters of cases in, we've had clusters of cases in all different kinds of settings. We've had churches, we've had businesses, we've had events, weddings, funerals, all different kinds of events. We've had congregate living type settings where we've had positive clusters. We've had even teams. So, you know, they're really widespread now, and we're seeing a lot of different people positive. So that being said, that it becomes more and more important. Not everybody who's walking around who is positive knows that they're positive, and it's really important to wear those masks and incorporate that social distancing of the 6 feet as much as you can, because it's we do have many people out there who we believe could be carrying it. And I think too, one thing I do want to just ask everyone on the call is if you would please make sure that if you have been tested and you might be waiting a test or you might be positive, please stay home. And if someone is calling you, please answer your phone. We have had to enlist the help of contact tracers from the state because we're so swamped here with cases now. And for every positive case, we probably have 2 or 3 people who want to know when they're out of quarantine or need some dates, or just it's been every case takes a lot of phone calls. So if you are positive, please do answer your phone, because someone's trying to get a hold of you and wants to help you to contact trace, help find that information so that we can make sure that people know that they might have been exposed. And also, and please, you know, we would encourage people to talk to us, because we really are just trying to help people to stay safe. And then also just please do remember to practice all those good public health interventions that we're recommending. And please also just be patient with us, because we're doing there's so many cases right now that it's we're working really hard to try to track everybody down, but sometimes we have a stack of notes still at the end of the day. We will try to follow up on every single phone call. So thank you everyone for all you're doing, and stay safe.
Hey, Laura, we did have a question in chat from you, from Stephen. Do you see that?
Oh yes, are they going to be doing any type of antibody testing for people? At this time, I think really more of the efforts are being focused on the rapid testing to try to make testing as widely available as possible for active infections. The antibody testing, we have seen some. I know that there are some groups that can do the antibody testing. At this point, this isn't necessarily one of the prongs that is really available to us. And I do believe if people want to be tested for antibodies, you want to make sure and check with your insurance and make sure that it's, you know what the cost might be, but it definitely, I think the antibody tests are not something that we know, the results, we're not exactly sure yet what they mean. So the most useful tests for us right now are the ones that show that there's been an active infection.
Thank you very much. We will go ahead and move on to the medical sector. And I do have Henderson Healthcare report. They said that they have received new infrared screening systems for screening employees and patients at their facility. They have also implemented some additional screening systems in some nearby school systems. And that would be their report. Jim, are you still on for the hospital? For York General Hospital?
Yes, I am, Lisa. Thank you. I'll touch on a number of things. Testing, definitely one of them. Laura, thanks for addressing the antibody testing question. Outpatient tests just continue for us, continue to be at a high level. For the October 22nd through the 28th, we saw 118 individuals, and it had netted 36 positive test results. And that's a little over 30% positivity rate. Now, a lot of those people are symptomatic that come through, so we should expect that. And in comparison, the 14th to the 20th, there were 134 that we saw with 37 positive. So you see over the last 2 weeks where that's been. Yesterday, we tested 106 individuals through Test Nebraska. And I believe that's the highest we've been in maybe ever. And the last 2 weeks, we have had 90 and 85 prior to that. And we have reviewed, and we will be signing a 6-month extension with Test Nebraska here in the next day or so. They're getting out the renewal contracts for that. So Laura, it's very good to hear that you're getting results back already on that volume of tests that we had. So we're aligning our outpatient testing schedule to meet those demand times. And we've swung into having some tests done in 7 days a week. We've had some that have been done on Sunday. I think this week, at least right now, we're planning on skipping the Sunday and actually doing 2 times on Monday, because it seems like the demand is a little bit heavier there. So we'll keep on it. That'll keep on going, ebb and flow a little bit on how we do the scheduling there. The Hearthstone testing continues 2 times a week for the staff and once a week for the residents. Now, there are no new positive the residents through the testing completed yesterday, and all of the restriction zones set up due to positive resident or positive staff exposure had rolled off. And that was until yesterday. We however had another positive staff member that of course is going to be quarantined on isolation, so forth, has put one hallway back in a yellow restriction zone. Why I point that out is we have systems in place that were mitigating that risk. And one positive for the Hearthstone, the way that they're set up, is they have different neighborhoods and hallways. And this kind of situation can be beneficial. And so due to the high level of cases in our county and health district, we plan to use the Binex cards and actually test our residents more often than we're doing right now. And we're going to be doing that in the weeks ahead just because of how high the case counts are and everything. Certainly want to be safe in that area. So the Hearthstone just completed their 4th infection control survey. Yes, their 4th. And the state is very, very busy doing that. And I'm sure other facilities around the region are getting that too. And so the last one that we had was triggered by that positive result that's now that resident is recovered now, and but we had no deficiencies in that report. So just a couple improvements to work on. So kudos to our team there. In the Willowbrook, all is going well, knock on wood, so far, and they have set up their winter indoor family visitation. It involves a lot of plexiglass and distancing and masking. So we're just limiting that to 2 family members at a time, doing what we can, but also being safe. We are taking a look at more mask and social distancing kind of education. Those that are followers on our Facebook site have seen the new mask video that we have. I think we're going to be putting out more of that. American Hospital Association and other healthcare organizations are working on some of that material for us. So be looking for more of that to come. This week, we have no change in our maximum visitor restrictions, the matrix that we use. And for the week ahead, we're judging it off the risk dial and case counts and positivity rate, and you just go on and on. We're looking at that, and we do that through our incident command group that meets every week. So we have same, I bet it's similar to Henderson. We have our screening kiosk machines are called Savants Health Kiosk, are being profiled for York General right now. And these will be putting out throughout our various campuses starting probably sometime next week. That depends on how the setting up procedure is going on all of those. And that'll screen automatically our at the entrances, employee entrances, and our main entrances at the campuses for our employees, as well as patients coming in, visitors, and even in our hospital campus, our wellness participants as well. Some COVID activity for you here and what we've seen. Definitely seen this as an uptick for us. So this would be from the 20th to the 29th. So I've just been adding on to it a little bit. Through the ER, we've seen 9 COVID patients that we've sent home after seeing them. 5 COVID patients admitted, 4 COVID observation patients, and then home, and 1 transferred to Bryan West out of the ER over that period of time. Med surge, 6 total COVID positive admits on our patient floor, 2 discharged home, and 4 current patients. So we've gone up quite a bit on our current load to have 4 patients. Our home health team is currently seeing in the homes 4 positive COVID patients as well. So the patients that are in the hospital are being treated with remdesivir, convalescent plasma, and dexamethasone as needed. And as of the 28th, as I mentioned, we have 4 COVID positive in-house patients. And so we've converted our entire 140 hallway, which is our east hallway, into a negative pressure hallway. So that's our COVID patient hallway, and that can treat up to 11 patients in that hallway. So the census on the floor in LDR as of this morning is 14. So our census is also up too. We have 4, as I mentioned, 4 COVID positive patients, and then 8 others down to 120 or the west hallway, and then a mom and a baby in the LDR. So currently we have 3 open beds that are non-COVID. So it's getting tight on that end, but we hope that a COVID patient may be going home today, and the way it goes in a rural setting and other hospital settings, some of those individuals will likely go home that are on the other floor as well today. We've just got to be very mindful of our hospital capacity here. So as of the 29th of October, the statewide COVID hospitalizations are up to 483. And that's quite a jump from yesterday, according to DHHS. And that peak back in May, when we had our first wave of COVID go through, that number was only 232. And so Dr. Antonin, we get he's a state public health, or the medical director of the state, and we look for another call here at 11 o'clock today, so I'll be able to update that number. But as of last week, 31 community hospitals and critical access hospitals like us were caring for 90 COVID patients. I bet that number is going up this week. We'll just see where that goes. So all of us, to echo what Laura says, we just need to do our part. This is real. This is surging. It's pushing our hospitals for what we can do and what we can take. And so everybody, please do their part of wearing masks, social distancing, being smart out in the community really needs to happen. It's all of our responsibility. But overall, and amid the COVID activity that we have, we're still providing that safe, quality care for the patients and residents we serve. And we'll continue to do that throughout. Everybody in the healthcare arena and all of us are exhausted, but we just keep up the fight, and we will continue to do so. So thank you. That concludes my report. And if there's no questions from me, I need to jump onto our organization safety huddle. Thank you.
Does anyone have any questions for Jim before we move on? Okay, so is there anyone else on the community briefing that would like to talk on the medical side? Then we will move on to the education sector. I saw that Brad Best was on. Brad, are you still there? Good morning.
Good morning. How are you? Very briefly, we are, as everybody is, dealing with day-to-day, hour-by-hour types of things. We have seen, and I am going to knock on wood, we have seen a decrease in the number of kids that have been quarantined. They're back to school again. We do have a staff member or two that are awaiting test results. We do have, and we have a positive, but the fact that we are masked 100% of the time, both students and teachers, that helps us considerably. We've also implemented procedures during our lunch period time and kids can do this, adults not so much, but to try to make sure that they eat as fast as they can, so to speak. And so their exposure without a mask up over their face is under 15 minutes. Not implementing that quite as religiously at the elementary level because those kids talk more than they eat, unfortunately. To try to herd cats in that situation is a little difficult. But compared to last year at this time, when we had a little bit of stomach virus and the flu season was starting to kick up, we actually have fewer kids out today than we did last year at this time. So we count that as a win. And we continue to be very careful on our protocols that we have in place. Overall, we still are sitting below 1% of our population as positive results back. We are really careful, I guess, maybe overly cautious. I don't know if that's could be even considered as overly cautious these days, but if we hear of somebody that thinks they might and they might be going in for a test, we've been making phone calls, and these are parents primarily or other family members. We haven't really had that many kids sick at all, but if we hear about other situations, we just pick up the phone and say, hey, until you find out, would you be okay with your kids staying home for a couple days, just to be cautious with that. Really, really good response from people on that, and I think that has helped tremendously, and not those accidental exposures that we may not know about from an asymptomatic child. The other thing you mentioned earlier with the hospital working closely with Henderson Healthcare, they have through grant funds provided us with an infrared temp scanner, and so we are on day 2 of that now. And after yesterday, what it does is it screens people for whether or not they're wearing a mask and whether or not their temperature is high or low. The low threshold was set too high. And so my phone, it text messages and emails our administrative staff if there's a flagged individual, along with their photo and the details of the scan. And my phone was blowing up last night because we had a group of junior high girls that thought it would be really fun to play with the scanner. So we obviously need to tighten up things there as far as the low temp, and we're putting wheels on the thing so we can hide it in a closet overnight. I think it'd probably be the better move, but it's all good. I'm glad they're exploring it and they know what it's for, and so we're really happy that we have that relationship with Henderson Healthcare, and they've been outstanding as far as giving us training and things like that on that. We will likely use that more often here, assuming we have some winter sports this year. We we may implement that with a reduced number of people in our crowd, keeping it below the 50% threshold that's established right now in the DHM, but then also still talking about it, but actually may require everybody to walk in front of the scanner just to double check that part of it. So so far doing okay. The frustrating thing for us, and on this call, I would mention that we are, as a school, very pleased with what we do in-house with our teachers and our custodians and our food service people and paraprofessionals, and our kids are just amazing when it comes to adhering to protocols. And then we go downtown to the post office or other places, and community-wise, not good. Masks and whatnot, it's just not hitting home yet. And I'm thinking you're finding that the same thing in many communities. We talked about this with Laura and about 15 other schools here last week. We'll do it again tomorrow, but you know, schools are probably the safest place right now in each community, aside from healthcare facilities. And yeah, when they go out into the community, that's where we're having our issues. It's evenings, weekends, or parents, or cousins, or neighbors, or whatever the case may be. That's where our cases come in. It's not really been a school spread at all that we can identify here, at least. So keep up the good fight, trying to get people to adhere to those recommendations in your communities, and that will help keep us open. And yes, I did make a poster that has a mother sitting there like this at the kitchen table, and the daughter sitting like this at the kitchen table trying to do homework, and it just simply says at the top, do you remember this? You know, if you don't want to go back there, please help us out in the community by wearing masks, washing your hands, distancing, things like that. So that would be an absolute last resort for us, though. I think we're way smarter today than we were 6 months ago. And we have other options up our sleeve yet to keep kids in school and safe, even if the numbers go up. So it would have to get quite a bit worse to close us down. We have other options that we can put in place. So far so good. Thanks to Laura and everybody on her staff and community people that are keeping the word, keep pushing, keep deflecting the dirty looks and all those things, and we'll get through it, I'm sure. But we're in a pretty good spot right now.
Thank you very much, Brad. I do not see any of the other superintendents on. If you're on one of the phone numbers, please speak up. Otherwise, we will go on to York College. They do have a report this morning.
Emily Lutz here with York College. We do just have a little quick update. We have 3 weeks to go until we have Thanksgiving break. And then after Thanksgiving break, we'll finish online. So we will do a week of classes and finals that way. We're really grateful to have made it this far, as opposed to some other schools in our conference or just that you see in the news. We have never had to have an entire shutdown. So our numbers in both quarantine and positive cases are at the lowest, some of the lowest they've been since we started school. And we're really grateful to York General for their help with testing our students and just doing stuff with us as we've needed. We did several weeks ago decrease our capacity for our indoor sporting events as the risk dial increased. We went ahead and did that before the new DHM came out. So we want to encourage you, if you're going to be coming to any indoor athletic events, to buy your tickets ahead of time so that we can control that capacity at 25%. And all of that information can be found on the athletic website at ycpanthers.com/tickets. So that's our big updates.
Thank you very much, Emily. Is there anyone else that would like to provide an education report? Okay, so we will move on to the local governmental sectors. I don't see Randy on, so there's no report from the county. Barry, I see that you're on from the city of York. Would you like to kick us off?
Sure. Just real brief. We've been continuing to talk about everything that's going on, trying to make sure that we do our part to keep everyone safe. Last week at the community center, Cherie implemented people wearing masks in the general areas when they come and go until they get where they're going, until they can social distance. Terry at the convention center continues to take temperatures and encourage masks to all the different events. And so we're just, as a city, just trying to keep looking at our facilities and our staff and trying to remind everybody. And I guess to wrap up, I would echo what's been said many times, wear masks, social distance, and be smart. And that's what we need to do to get through this. So with that, we will follow the health directives and four corners, and if we need to take further steps, we won't hesitate to do that. So be safe, everyone. Thank you.
Thank you very much, Barry. Are there any other communities that would like to give a report at this time? I know Benedict typically doesn't. They are on. Okay, so we will move on to our faith communities and our nonprofits. Do we have anything from York County Health Coalition to report this morning, Jake?
Hi, the only report that I have to add is that we have received a few more masks. It's not a massive amount, but we emptied out immediately after our last meeting, which was awesome. Thank you everyone for utilizing those. Based on that response, I went ahead and got a few more. We've got a little bit. I know that that the city of York has asked for some, so I've set some aside there. And then we have a few more left. If anyone is interested, do please reach out. They're very limited this time. I'm very sorry. The response was good. But we are also still trying to identify other sources of masks just so we can help to support the community in that way. Hopefully further education will increase the demand for these, and then we'll hopefully have more to meet that demand.
Thank you. And if I'm incorrect, feel free to let me know, Jake, but there are still COVID funds. So as everybody on this call is working with people, if they've been impacted financially because of COVID and they need assistance, have them reach out to Jake.
Yes, that is correct. We do still have COVID funds, and there has been a response to that. People have been listening when we've said that, and so the funds are still there. Though we are still happy to support. Obviously, we'll support until the money runs out, which it hasn't yet.
Thank you, and we will move. Is there anyone else from the nonprofit world that would like to say something right now? Okay, we will move on to the business sector. I'm going to start and then I'll have Madonna wrap it up, and then businesses, if you're on and want to say something, you can. I do want to say, some of you might have seen Melanie's report last week. We are back down to 2.2 unemployment rate, and we have businesses that are hiring. So please feel free to send them to yorkdevco.com to our jobs directory there. If you have somebody that's moving in, you can connect their spouse with Derek, and he can help you get connected with the right business based on their skill sets. I know he's working with a couple right now, but there are plenty of jobs available from entry level all the way up to some high skills. So I want to throw that out there. If you know people, great opportunities for them right now. And then I had a phone call, a Zoom meeting with the Nebraska Department of Economic Development yesterday, and the small business stabilization grants are gone. The money's completely gone on those. The child care stabilization funds are gone as well. There is livestock funding left. If you did not receive the first round of funding, I strongly encourage you to go through the process and go for the $12,000. That can help you out a lot. There is funding left in the hotels and convention centers fund, as well as the theaters. And when you look at the theaters, it's per screen. So you can go, you need to apply. If you haven't received it yet and you follow one of those categories, it will help you out. So please apply with that. And then there is a small amount left for cosmetic, massage, and body arts services. So that would be a little bit more time sensitive if you're a hairstylist or massage therapist, any of those categories, and you have not done the application yet. I strongly encourage you to get it done ASAP because there's just a small amount of funding left. On a non-COVID related issue, my staff and I continue to receive questions on when Jimmy John's is going to open or if they've pulled out of the market. I do want to say they are coming. They have their building permit. They might have started construction. Everything's moving forward. I don't have the exact date that the construction will be done and they'll be doing the opening, but I would anticipate it being probably in January. So as you guys hear questions on that, feel free to spread the word that they are coming. That seems to be a hot question these days. It's non-COVID related. So I wanted to put that out there. Madonna, I will turn it over to you next.
Thank you, Lisa. I do want to definitely thank Four Corners Health Department. I know that they are working long hours. So I want to just echo what everyone has said. I appreciate very much all the hours that they put in, the assistance that they give families, and also York General for the work that they do in working with families to move through this COVID time. Really, I just want to go ahead and just highlight the fact that our team is busy gearing up for the holiday season. Rhonda has been communicating with our membership and sent out some forms, electronic forms. We want our membership to fill those out to let us know your plans for the holiday season. We are really promoting Let's Keep the Cheer Here. And our local businesses are doing a great job. They've been doing a great job in presenting very safe, comfortable shopping environments. And they're continuing to do so during the upcoming holiday season. A lot of them are implementing Sunday hours, really encouraging more time for people to come in and casually browse to avoid large numbers at one time. So be watching for a big push on Let's Keep the Cheer Here from our office and from all of our, not just retail, but all of our service businesses as well, all usually take part. We will have Small Business Saturday taking place on November 28th. We will continue to we've been building that for the last several years, and it's definitely something everyone looks forward to. Santa will be in his hut. I've been working very closely with him on how we're going to have some very comfortable visiting situations there. So we really appreciate all the support the community gives us, and we in turn want to do all we can to support our community and our business community, and continue to do well, everyone.
Thank you very much, Madonna. Are there any businesses on that would like to say something for their business right now? Okay. There is a message here to check with the First Presbyterian Church for masks. So in addition to the Health Coalition, you can go to the First Presbyterian if you need masks. That's a great thing. Thank you, Deb, for putting that in. Is there any other comments or questions? If not, we'll wrap it up, and everyone have a great weekend, a great week, and we will look forward to doing this again in 2 weeks.